assistance on the bill as well. What this bill will do is very simple, establishes a training standards and requires the Department of Alcoholic Beverage Control to accredit training providers offering responsible beverage service training courses. This bill requires all those who serve alcohol for on-site consumption to undergo and pass a responsible beverage service training course. According to the National Highway Traffic Safety Administration, more than 10,000 people throughout the United States die on our roadways due to drunk driving, approximately 900 of those every year in California. When people drive under the influence, it not only puts the driver at risk, it threatens the lives of passengers and all others who share the road. The social cost is clear, but we have to figure out what to do about it. 18 states and the District of Columbia have already passed a mandatory responsible beverage training course. In fact, a study of Oregon's implementation of such a training for beverage servers showed a fatal single vehicle nighttime crashes decreased 23%. We know this works, and we know it's time for California to adopt it. I have some witnesses with me today to testify.
Move the bill.
Thank you.
Good morning.
Morning.
My name is Cecilia Bonner, and I'm a third-year medical student from UC San Diego and a student member of the California Medical Association. The bill you're voting on now is written in response to a great tragedy suffered by my community. In May 2015, two of my fellow medical students at UCSD were killed by a drunk driver who was so intoxicated that he was driving the wrong direction on the freeway. A third classmate spent months in the hospital, not as a provider, but as a patient. And the two students that were killed, that's Ann Baldock and Maddie Cornwell, they were the kind of people who gave back to their community. They advanced medicine, they cared deeply for their patients. Ann was an aspiring neurosurgeon, and Maddie was just weeks away from boarding a flight to Africa to spend a year volunteering to help malnourished children. It goes without saying that the medical community was and remains devastated by this loss. In the days and weeks after Ann and Maddie's death, my community at UCSD couldn't stop asking why. And being medical students, the first thing we did is started to do some research, and we were appalled to discover how common it is to see similar headlines in the news saying, drunk driver kills 3, or suspected drunk driving in an accident that claims young family. It became clear that we were dealing with a pattern of tragedy and not a series of isolated events. Our medical training teaches us that we need to identify causes of mortality and then implement evidence-based interventions to address them. And that is the exact process that led to the bill before you today. AB 1221 is a bill that will save lives on implementation without undue burden on industry or private sector. And just as we are taught to practice evidence-based medicine, AB 1221 is evidence-based legislation. The UCSD medical students are incredibly appreciative that Assemblymember Gonzalez-Fletcher authored this legislation and that our professional organization, the California Medical Association, joined as a sponsor. So I'm asking on behalf of myself and my school and the California Medical Association for an aye vote today on AB 1221. Thank you.
Thank you. Next witness.
Mr. Chair, members of the committee, thank you. I'm Mike Skippa with Alcohol Justice. I'd like to thank the author and her staff for bringing forward a bill that actually is the other side of why we're normally here, which is to oppose a degradation of alcohol control policy in California. This is the other side of the coin, and we're proud and happy to be able to support this bill because sales and service practices do play a key role in addressing the risk of injury and other harms that arise from excessive alcohol consumption. Preventing the overservice of alcohol will help to reduce all alcohol-related problems in the state, and we believe that the passage of AB 1221 will help reduce California's annual $35 billion in alcohol-related harm, 10,500 alcohol-related deaths, 17,700 alcohol-related hospitalizations, and $14 billion in actual government costs annually. We look forward to your aye vote on the bill. Thank you.
Next witness.
Mr. Chair, members of the committee, Chris Walker on behalf of the California Craft Brewers Association in support of the bill. We applaud the author and the sponsors' focus on safety. Our biggest concern is that when our employees are seeking out this training, that it be accessible, that it be inexpensive and easy to get. We do believe the ABC is able to pursue this and provide this type of training in a very simple format. While emphasizing safety. We don't want this to become another excuse for a cottage industry to be born, a for-profit entity that causes our employees to have to go out and procure expensive training. So thank you.
Hi, Greg Hayes with KP Public Affairs on behalf of the California Restaurant Association. The current analysis reflects our opposed unless amended position. The author has taken the suggested amendment that was in the analysis, which we'd like to update our position to support if amended. There is one technical amendment still that we are seeking. I'd like to say that this process from the very beginning has been extremely collaborative with the California Medical Association and the Assembly Member's Office and her staff. We greatly appreciate it. We're a year and a half into this after the bill was vetoed last year. The California Restaurant Association is in support of the concept of having this training offered. We understand the goals, the underlying goals here. What we sought from the very beginning was to make sure, as Mr. Walker just explained, that this is accessible and inexpensive for the employees, and that we also are careful not to sort of pierce the liability that the restaurants currently have in law, restaurants and bars. The bill currently says that the training providers must be accredited. What we're seeking is a standard for that accreditation, that we're dealing with a serious issue. We want training providers to be credible. We want when someone shows up to one of our restaurants with this card that we can validate that it comes from a credible source. So that's what we're seeking. Thank you.
On your way to support.
Support if amended, yes. Thank you.
All right. Anybody else in support? Anybody in opposition?
Good morning, Mr. Chair and
So I
members.
didn't see you back here.
Michelle Baca with the California Medical Association, proud sponsors of the bill and in strong support. Thank you.
Thank you. Anybody else in support? Anybody in opposition? A bit blah.
Good morning, Mr. Chairman and members. Christy Weiss on behalf of Health Communications. We operate the TIPS program, which is the largest provider of responsible beverage server training in the country. We have an oppose unless amended position on the Assembly Members Bill, and not at all because we are opposed to making this training mandatory. Our client they've spent years and years and years developing these trainings, and they have seen how they can effectively train servers to help patrons and customers and folks who may have been overserved and avoid the tragic situations like the one that brought the bill to bear. So we are not at all opposed to the concept. Our opposition comes from a desire to seek additional amendments to strengthen the framework that would be in the statute that would make clear that both the providers who offer these courses and the courses themselves are meaningful. We share the concerns that we don't want to see a cottage industry come up that puts together programs that don't provide meaningful training. Some of us have gone through online traffic school as an example. Sometimes that's not as meaningful as it should be, and we are seeking to avoid a replication of an environment like that with this bill. Additionally, we think that the ABC should be the ultimate entity to determine who provides the courses and what's in the courses rather than a third-party accreditor. So we'd like to see the role of the ABC expanded here. We appreciate the willingness of the Assembly member to meet with us and talk with us, and we will continue to work with her on amendments as the bill moves forward.
Thank you. Anybody else in opposition? Seeing none, any member comments?
Yeah.
Senator Berryhill?
Yeah. Originally, I was going to abstain on this bill, but obviously there's been a little bit of a change of heart today. And so just question the author as far as moving forward with this bill, you're willing to continue to work with these folks and maybe streamline this thing a little bit more?
I just want to be clear because maybe I'm too far into the weeds on this, but although it sounded, what people said sounded great, but they're in exact opposition to each other. So I can't keep the Restaurant Association as a supporter and satisfy what TIPS would want. This is like their and I would hate to give you the background on all of this, but basically they're opposed.
Neither do I.
This is all I promised to do.
Congress.
I know. It sounded all nice, but there's no way of satisfying both. ultimately, and I've said this at every committee hearing, I'll say it again, we will ultimately have a framework that the governor's office says okay to. Because what happened last time is they didn't like the way we went, and despite the hard work, I mean, these medical students actually came up with a bill. I had an intern, they came up with a bill, they sold it to me. This is so important to them and to our community in San Diego, and everybody conceptually likes the bill, and then when it gets to the details, that's why it was vetoed. So irrespective of all these good people who I think have good intentions, whatever the governor's office says is signable is what we'll end up with. I don't know if that answered your question. I don't want to give false promises because I don't know what they'll say.
Yeah. All right. Well, thank you very much. I'll be supporting the bill today.
Thank you.
Senator Gaines.
Yeah, great. Thank you, Assemblywoman. I appreciate you bringing this forward. I did vote for it last year. And it sounds like you're working with governor's office and hopefully you get signed this round. And I appreciate the fact that you're working with the Restaurant Association and to the degree that you could help them, because I know that it's tough doing business in California, and anything that we can do to try to make it a little simpler, I'd appreciate it. But I really appreciate the cause and the purpose. So I'm in support.
Like to close, Assembly Member?
I just want to note that our goals are the same. I mean, when we talk about especially workers not being burdened, I lived my former life being a representative of workers. We don't want to attach a burden or a cost to them that is unnecessary or large. But so we absolutely, I think, have the same goal, and I'm sure we'll be able to work out those. We'll ensure that this bill maintains that. So thank you, and I respectfully ask for an aye vote.
Great. I want to thank you for bringing this bill forward. I understand that conversations are going with the department, the governor's administration, and other stakeholders. Obviously, as this bill moves forward, what we're all interested in is having the highest, standards possible. So thank you for bringing this forward. Can we call the roll, please?
Item 11, AB 1222, motion is due pass as amended to appropriations. Dodd.
Aye.
Dodd, aye. Berryhill. Aye. Berryhill, aye. Bradford. Aye. Bradford, aye. Cannella. Aye. Cannella, aye. Gaines. Aye. Gaines, aye. Galgiani. Aye. Galgiani, aye. Glazer. Hill.